This is Platemark. My name is Ann Shafer, and I am your host. This is Series 3 of Platemark, which is interviews with incredibly interesting and wonderful people who occupy various roles in the print ecosystem. And today's guest is a little out of our norm. She's in a different swim lane, which is so cool. Her name is Naomi Huth. She is the chief curator at New York City Health and Hospitals, which is the largest municipal health system in the country. And she is responsible for a collection of works that are on display throughout 90 facilities across 5 boroughs in New York. It ranges from WPA murals to prints on the wall and photographs and all sorts of stuff. So it's a really interesting part of the art world that I think, I had never found anybody who works in it. So I was really fascinated to talk to her. So I hope you'll enjoy it. Okay, housekeeping. I identify as a cishet white woman, and I use the pronouns she, her. I record Platemark in Baltimore, Maryland, the land of the Piscataway Conoy people. Links or pictures that we talk about will be over in the show notes for you at platemarkpodcast.com. Also, a plea to increase your interest in supporting Platemark. It's just me, and your support, if you value what we do, would be most welcome. So head over to platemarkpodcast.com and hit the support and donate button. You can become a monthly subscriber, or you can do a one-time donation. It's up to you. All right, I think that's it. Let's get rolling. Naomi, thank you so much for coming on Platemark. I've been dying to talk to somebody like you, so I'm thrilled you are here.
Thank you so much for having me. It's really a pleasure.
Sure. So you work for New York City Health and Hospitals, which might sound completely unprint related to the listeners, but there was a specific reason I wanted to talk to you, because you are the art person for the system.
Exactly. So I'm the chief curator and the director of the art collection for New York City Health and Hospital in the Department of Arts and Medicine. We have one of the largest public art collections, definitely in a hospital system, and debatable if it's, what the size is compared to other public collections, but definitely one of the largest. A lot of what we do is try to look at what artwork we have, what the spaces are like, and create sort of healing environments throughout all of our facilities.
Can you estimate how big the collection is?
Yeah. So we know that it is, I'd say it's over 7,000 pieces and growing daily.
Now the fun part.
Exactly.
Well, yeah. So before we get to sort of the ins and outs of how you managed this whole project, because it sounds gigantic to me, tell us about you. How'd you find yourself in the arts?
So my background is in curation. Before this job, I worked for about 10 years curating for a private collector. And before that, I worked doing both adult programming and curatorial work for a variety of different museums and also for a couple galleries. My father's an artist, so I kind of grew up around art, always knowing that I would have nothing to do with art, obviously. So I went to school, planned to be pre-med. I went to UPenn because they had 8 hospitals on campus. They had a specialized program called Biological Basis of Behavior, which I thought was perfect for me because it put me on the track to being a neurosurgeon, which was my whole plan. But I really love bringing artwork to people who feel like they have no entry point into art, specifically contemporary art, and really giving them that power to feel like they have a place there and that art is for them and that they can understand it. So for me, this role felt like a natural progression of what I've been doing and was really, really a great opportunity to take my expertise and to blend it in with what this department was already looking to do.
I love it when people are like, oh yeah, I was going to be a neurosurgeon.
I think it's really funny that it was like, I started with art and then I said, I definitely am not going to have anything to do with that. Kind of looked towards moving into the healthcare field and then switched immediately from that. And now I'm back in this place where it's a mixture of the two of them. And it's honestly, it's an area, this arts and healthcare field is an area that when I was an undergrad, I didn't know it existed. I think that it is an area that is really growing rapidly now. And I'm just like very excited to be a part of it.
It's like you're on the leading edge. It's it's funny because we just met recently because you sent a little connecting thing through LinkedIn at me. And usually they're like the podcast, guru types. Let me get you more people trying to connect. And all of a sudden I'm like, oh my God, she's in the health system. I have to talk to her. Because as a person who's trying to get this print fair rolling in Baltimore, trying to find the people who are the corporate buyers and the private collection buyers and the healthcare system buyers is impossible. I can't find you people. So I'm so happy you're on my podcast.
Yeah, I mean, a lot of what we want to do with our department is really raise awareness for who we are and what we're doing. And again, what the healing power of art is. I think there's, even in the art world, there's so many people who work with art on a regular basis. And I think they forget how powerful and how impactful being surrounded by artwork really is, and how much it changes your mood. It changes how you feel in different situations based on what's there. So, that's a lot of what we want to do, is really kind of promote what we're doing and how important it is in these spaces. So I don't know how familiar you are with New York City Health and Hospital, but we are the largest public safety net in the country. We're a public hospital system. We have over 90 sites, which include full-size hospitals. It includes clinics throughout all of the boroughs. There are long-term care facilities and nursing facilities as well. And we are really open to everyone in New York City, no matter if you're insured, no matter what your immigration status is, no matter what you can or can't afford. So we are really there for everyone. And we like to think of ourselves, it's not just that we're a public hospital, but we really are there to kind of represent and be a support system for all New Yorkers.
I'm kind of fascinated by this idea of a municipal hospital system acting as a nonprofit, because there's a big donate button on the website. That there's this idea that it needs communal support from people who have the ability to like, it's this funny intersection of nonprofit and government that I find really interesting.
Yeah. I mean, this is my first role working for city government. I've been here in this role for a little less than a year. I started last Halloween. So in terms of answering those sorts of questions, that's not something that I'm familiar with and can answer, but I'm sure I could get you that information and explain everything at a later date.
Hey, everybody, it's Ann breaking in to let you know that there's a third voice that's about to jump on the call and explain a little bit about the budget for New York Health and Hospitals. It's a colleague of Naomi's, Stephanie Buell, who sat in on the call with us, and she offered this helpful note.
Just for your awareness, city government funding is about 10% of our budget. So a lot of it is Medicaid and Medicare reimbursement, and then some private insurance reimbursement. We are government, we are a city agency, but at the same time, it's only a small piece, important, but small piece of the pie.
Right.
I'll also add on to that. So our entire department is almost entirely grant funded. The arts are really important to the leadership at New York City Health and Hospital. At the same time, as you can imagine, there are a huge number of demands in the system of, actually saving people's lives. I can give you kind of a little bit more history about our department as well.
Oh, sure.
And
Absolutely.
About the art. So the collection started in the 1930s with WPA murals. We have a very large collection of WPA murals. We've continued that tradition of mural making with our community mural program, which started in 2019. And with that, we do a collaboration of murals that are actually painted by people in the community and then put up throughout our sites. In around the 1970s, there was an art advisory council that was formed. It was a mixture of people from museums, advisors, artists, arts writers, different government officials to create a collection. So they added at that time around 3,000 pieces, which really started off this collection. And then in the 90s, there was a decision made to decentralize the art collection, which means that each one of the facilities was given the responsibility for taking care of the collection. And as you can imagine, with 90 plus sites and all of the staff, they're really having a lot of work that they already had, and not having an arts background. The collection fell a little bit into, I don't want to say disrepair, but there wasn't really that much of a focus on taking care of it. And then around 2018, there was a real strategic decision to create an arts and medicine department. We are under the umbrella of quality and safety, which includes the entire wellness department. It has input from facilities, has input from the police department as well. And the focus is really on staff well-being, trying to create this atmosphere that helps reduce staff burnout and really helps people feel connected to the space that they're in and connected to each other and to their patients. So as I said, I started the end of last year, and we've been trying to grow this department and have there be a really strategic plan going forward as we put artwork through all of our facilities. There's some that, you might be familiar with, like Bellevue, for example, is one of our hospitals. Harlem Hospital is as well, King's Hospital, Woodhull. So, there are a lot of these facilities all throughout the boroughs. And I think that it's something that a lot of people aren't even that familiar with, which hospitals are part of our system and the strategy throughout our whole system to put artwork inside everything. But I also say that the artwork that we have in the collection, it's a mixture of this work from the 30s, from the 70s. We have some works that were commissioned through the Percent for Art program. We have a lot of works that are donated, and we're really looking to expand. I know there's a lot of information.
It is a lot.
We're all, it's a very big organization, and we have a lot, and we're trying to do a lot.
Right. Right. How big's your staff under you?
I have 2 interns.
Oh, okay. Not enough is what you're saying. Sorry.
I think that's the case for every place, no matter how big or how small. You can always use more staff, especially, if you have a plan, if you're looking towards the future of how to expand, you really can always have more staff. I think for us, it's really great that we have a small team because we've all kind of started around the same time. We're all able to discuss what our vision is for how to grow the department. And then as we bring people in, we're able to really mentor them. Our internship program is something that we started just this year. And we really can bring people in who are also excited about what we're trying to do and grow the department together.
The first thing that when you were talking that struck me was I assumed that the vision and the mission was for the art to create an atmosphere for the people who are coming to the hospital as patients or family members. And I had not ever considered the staff.
Mm-hmm. Yeah, so, with work up on the walls, it is there for the patients, but our department tries to think about staff first because there is an epidemic of staff burnout. Our staff see a very large number of patients. They all have a really intense workload, and having the artwork there really, really helps them feel connected to the space where they're working. For patients and for staff, what we try to do is have a really diverse group of work on the wall, have the work often connect to what that department is or what that community is. And in that way, we build trust. Often when patients or when the caregivers can see themselves reflected in the work that's on the wall, it makes them feel a sense of trust. And it also, we found that it really helps communication between the patients and the staff.
It does?
Yes. So, a lot of what we do when we're putting up work throughout the facilities is that I'll sit down with each one of the departments. I'll have a conversation with them, see what the space is used for, what sort of environment they're looking to create, and what they really want this space to be. So, for example, I did a space recently at one of our Gotham Health sites in the Bronx called Morsania, and one of the areas there was a women's clinic. So part of that conversation that I had with them was not just about creating a warm space in their waiting room and in their hallways, but what could we do to connect people to, to the staff and to their environment. So the work that we put up there is all work that is done by female artists. It's work done by women of different ages, different backgrounds. We have imagery of women. We also have abstract paintings that are up there. So when people are there, they're able to look, connect with that and feel some sort of connection with them and in the space. And I think that works the same way for the caregivers as well.
Do you have wall labels up? How do people?
We do. So one of the initiatives that we've been working on is we teamed up with Bloomberg Connects. I'm not sure if you're familiar with them, but they have it's done through Bloomberg Philanthropies. It's an app where they have over 250 different cultural organizations. We're the first healthcare facility, a healthcare site to be on there. We have labels that we're putting up throughout all the facilities. They have educational information about who the artist is, a little bit about them or about the work. There's QR codes on everything so people can learn more on the site. We are including a number of videos, different audio files on there as well so people can learn more. And we found that it also helps when you have patients who are sitting in these areas, when they often come in, they can feel very stressed out, and it gives them something to keep them distracted. And for the staff, it also ends up giving them more of a feeling of power and control over their space because they understand what the work is and what's around them. It's like if someone went into your home and they asked you a question about the pieces that you have on the wall. When you're able to explain to other people and help educate them, it makes it feel like this is your space. This is something that you're sharing and you're welcoming people in. That's the same feeling that we want to create in these spaces. There's also been quite a lot of scientific research showing that when people are in these spaces and they're surrounded by artwork and they have something to distract themselves, it actually lowers your perceived pain threshold. It helps with recovery times. It reduces stress. There's really a lot of therapeutic value in being surrounded by artwork.
I'm glad that people have decided to do studies like this because art appreciation is such a ephemeral, misty kind of, how in the world do you judge whether or not I'm calmer because I have a work over my desk? I mean, it's so counterintuitive, but I think, having the science to back it up, I think that needs to be more publicly recognized,
No, I agree. So I just actually came back from a conference in Cleveland with NOAA. It's the National Organization of Arts and Health. And they're really trying to bring people together to look at what the science is behind it. As I mentioned, all of our installations and everything that we're putting up, there's really scientific reasoning behind everything that we put up. There's certain colors and there's certain images and artwork that have been shown to either be soothing or based on what the department is, can be a trigger or can make people feel more stressed. So we really try to keep all of that in mind.
So I imagine that if I were a collector of some note and I decided to say, hey, I want to donate these things and they're all like super political or charged, you'd be like, no, thank you, Ann.
Exactly. I mean, we're always looking for donations. We're always happy to have those conversations. That being said, just because we have so many spaces and we need more work on the wall does not mean that we can accept everything. We really, really try to make intentional decisions of what we are adding with the thought of where can this go? Because like you said, there's certain imagery. It might be political. It could be specific religious iconography. It could be, a huge canvas that's just bright red. There's certain things that are triggering to different types of people. We're not just putting up nature scenes. We have a huge variety of work. We have Helen Frankenthaler, we have Andy Warhol, we have Jennifer Bartlett, we have Dawood Bey. We have a huge number and a huge variety of artists, but we really do try to look at what the images are and think about where those are going to be. So, images of doctors performing surgery, those are the sorts of things that I've had conversations with people who think, well, that's perfect for a hospital. But in reality, those sorts of things actually are not always suitable. And a lot of images that have to do with medicine are not suitable because you have people who are going into these spaces already feeling anxious or stressed or, a bit hesitant about being in the space. And we want to help bring down that stress.
You can't ever know what people will bring to a work of art, right? So triggering for you might not be, it's hard.
Exactly. So a lot of what we've been instating as we kind of move forward is that before we put work into any department, I go to the space, I have conversations, not just with the head of the department, not just with one person, but with the people, as many people as I can who are going to be working in that space to figure out what works. So this year, I've done quite a number of different behavioral health units. I've done inpatient, emergency, and outpatient. And each area has a different need.
Have you worked with artists like Dawood directly and banded together to collaborate on series of works that might be appropriate in certain places, or?
So I've been here for less than a year. So a number of the commissions that we've done were before I started. That is definitely something that we are interested in, that we are kind of looking to do in the future. I know that there are a number of contemporary artists who have been doing collaborations with hospitals, really kind of filling in multiple floors with their artwork and kind of creating amongst these immersive environments. In terms of more recently working with artists, as I mentioned before, we do have a community mural project that we have different artists come in and we do focus groups. They talk to a number of people, both patients and staff and the CEOs, understanding what those spaces are used for and how they want to represent their community. And then we put in those pieces. We also have an arts in residence program. And we've also been working with a few different artists for our Guns Down, Lives Up program as well.
Tell us about that.
That's something that I would love to give you more information, but I know we're still kind of working on it. So what I can say is that we have a really beautiful mural that's been created that's going to be going up soon. We're doing a collaboration with a few different artists, and we'll be having a concert at Carnegie Hall later this year. I believe it's in November. Part of that program was also working with some different people in the community in Brooklyn, where they put on a performance of Romeo and Juliet.
Oh, wow. This is making me think that that patients and staff could benefit from all sorts of different kinds of arts, like classical music or whatever. Like there's so many ways you could take this aspect of wellness.
We do have a music program. So besides the visual collection, we have a number of programs. We have a program called Music for the Soul, where we have musicians come into the different spaces. They often do it kind of around lunchtime. That way it can coincide with staff taking a lunch break. They can sit, listen to music. We also have a program called the Lullaby Project, which is working with Carnegie Hall, that brings musicians in with new mothers as a way to help women bond with their babies right away. As I said, we have an artist in residence program. We also have a program called Heart of Medicine, where we have teamed up with the Brooklyn Museum and the Whitney Museum. And it's like an observational art workshop where we'll have an arts therapist and arts educator come in. They work with small teams from different departments. That program is focused directly with staff. And they will take a look at a piece from our collection that also is an artist who's in one of those two museum collections, learn a little bit about the work. People are able to share their experiences with what they do in their day-to-day job with kind of what they see in the artwork. And then the second part of it is art making, and the staff is able to come up with their own version of that piece. And so that's something that we've done printmaking with that, with the Schroeder Cherry piece, learning about the different mediums that artists have, the different ideas behind it, and kind of giving the staff a time where they can relax and think about themselves in the middle of a busy workday. So yes, you're exactly correct. Music, art making, all of these different sorts of therapies are things that we are actually really doing.
It's so hard because I would, people will say, is that a poster or is that real, quote unquote, real or whatever. And so I was worried about this in the museum too. Like it would be so much better if I were standing there and helping you engage with the work than letting you just walk by it with a second and a half glance at it, because it somehow doesn't draw you in right away or something like that. But, I always worry about the folks running around Hopkins Hospital here and seeing the polyethyl suite, by the elevators or whatever. I'm like, don't you know what that is? It's so cool.
That's exactly why we teamed up with Bloomberg Connects and why we've been doing signage everywhere, because as we are starting to put up signage, we've already seen the effects that has on the people who are in those spaces. Because like you said, before there were signs, people just kind of walk by, you're not really paying attention. Is this a medical poster? Is this an actual poster? Is this, an important piece of art history? There wasn't any context for people. So everyone just kind of sped by it. But now as we're putting up all of this educational signage, and we're putting it up in a way that is geared towards a non-art audience to help them feel like they can connect to it. We're noticing that people are spending a lot more time with the artwork. There's a lot more requests for artwork up throughout all of the spaces. And actually, a funny story, which is that we have a 700-foot-long Keith Haring mural from 1986 up in Woodhall. And I put up signage there earlier this year. And when I went there to go check, make sure that the signage was still on the wall, that it wasn't falling off, I had two different people come up to me and say, "Oh, have you seen, there's a sign over here. You can read more about this artwork and you can go onto this app and learn." And they were patients who were just in the space. And so we're already seeing that people are feeling like they have that sense, that feeling of control in this space where they're waiting. And, like you said, when people go to museums, they often kind of rush through. And yes, they've made that decision to go in and to look at the artwork, but we have people who are in these spaces, sometimes sitting there for hours and hours and hours. And so, what we're doing is giving them this opportunity to learn about the work, to know that art is for everyone, and help distract them a little bit and make them feel calm and happy in that space. So yes, signage is very, very important to us. And something that we really want to get up everywhere. In terms of posters, we have, I'd say, about half of our collection are editioned prints. We don't have a museum poster, that sort of thing. When I said about 7,500 pieces, I'm not counting any sort of posters. Everything that we have is original artwork.
Right. I always talk about the problem of the word print nomenclature. You print your letter to send out or whatever. And, the poster print thing is always a problem anyway.
I think that also, that's part of educating a lot of people, which is that I think it's the same situation when you say a C print, is that somebody who isn't an art person is going to think that means it's a print. That means it could be a poster, or, this is just mass produced, as opposed to C print would be photography. Again, that's where the signage and Bloomberg Connects comes into play, because we are able to help people kind of understand what this is without making people feel stupid. I find that so much of the reasoning, at least in my experience, of why there's a lot of people who say they don't like art is because they don't understand it, and they haven't felt like there was any real effort to educate them in a way that connected with their experience. And it's so much easier to say that you don't like something rather than admit that you don't understand it. And so what we're really trying to do is let people know that this is for you. This is for everyone. Just like our hospitals are there for everyone, no matter what your background is, the art is there for you. No matter what your level of art history, knowledge is, or interest is, it's there for everyone.
Right. Are you writing all of these wonderful snippets of information?
Yeah, so that is part of being a small department, which is that, yes, we are able to control what we're doing. At the same time, it obviously means that we all have to work together as a team to kind of get everything done. For right now, at least as we're growing, if we want to do something, then yes, we all have to do it ourselves.
Hey, I worked at small museums. It's the same thing. I remember hanging labels when I was a kid. Really a kid. I worked at the Whitney, and we were putting up wall labels, and they were kind of sticker letter set sort of things, and you rubbed them onto the wall, and I would just drop the little, piece of plastic paper. And I saw the head of security coming behind me and picking them all up. And I thought, oh, Jesus, like, who did I think was going to pick them up?
Exactly. So yeah. So, I put up all the labels. I'm there for all of the installs, for all of the conversations. I actually was just over at one of our facilities this morning, double checking a space, because we have started an exhibition program as well. So our first exhibition will be opening in just a couple of weeks in October. And I should say our second exhibition. Our first exhibition is going to be opening up next week. Second exhibition will be opening up the second week of October. So, yep, going over there, making sure that all the spaces are ready, checking to see if there's any issues, if there's any new construction that's gone up, making sure that everyone, is aware of what we're doing.
Do you worry about security, the security of the works?
It depends on what the spaces are, but we have different types of framing that we have in different areas. So for the majority of the work, everything is very securely bolted onto the wall. And then we have a different type of framing that we use for behavioral health areas, which is anti-ligature framing, which means that essentially, rather than there being sharp edges, they're all kind of rounded and curved. We have additional kind of a silicone that's added behind the frame so that nobody can kind of put their hands behind there or do anything to injure themselves or injure other people. So, we make sure that everything is really, really secured onto the wall to protect both the art, the staff, and the patients.
You're I'm sort of in awe here. You're the job is to find, collect, take care of, display, but the considerations that you are dealing with are so far beyond what a gallerist or a museum person has to keep in mind the whole time. It's insanely complicated.
Yeah, I think that in the art world, I think, and I'm saying this as, coming from being entirely in the art world before this, I think that we all kind of take it for granted that when we look at a work of art, you look at it for its aesthetic value, for its placement in, in art history, and we don't really think about what its effect is on other people. There is thought put into how work is displayed, but it's how is it going to be displayed in, like you said, like in a white cube, rather than how is this going to be displayed in a healthcare facility. And I honestly think that some of that applies in gallery settings as well, where the work is not going to always go right from a gallery into a museum. It's going to go into people's homes where people are living with it. Sometimes people have young children or grandchildren, or they have parties, or their windows aren't treated, or they don't have appropriate lighting. And, there's only so much of that you can control, but that isn't the gallery's job to think about those things. It is our job to think about how this work is going to be displayed, how it's going to be protected, and how to present it. So we really try to be very intentional with everything that we're doing.
That's a big job. So how, aside from the gifts that you happily accept if they're appropriate for the collection, don't call us, we'll call you. Where are you going to buy things? The fun stuff?
So, I've always had, like, art has been kind of my entire world. Everyone that I'm friends with is in the art world. All of my activities outside of, kind of 9 to 5 in the office are art events. When I travel, my entire vacation is spent doing studio visits, museum visits, that sort of thing. So I feel like I've always really immersed myself in art. So I kind of look at art everywhere, I go to as many art fairs as I can, museum openings, gallery openings, big, small, all over the world. I really love actually going to regional museums. I think that they are a space that is really, really overlooked by kind of East Coast and West Coast art community. And I think there's so much really, really wonderful artwork. And I think that a lot of regional museums do a great job of highlighting their local art community. So yes, that's the long answer to your question. I look everywhere. I try to always keep an open mind of, kind of what's out there and what we can add.
Right. And so, of course, my museum brain is churning here. So when you are somewhere and you see that thing and you're like, God, I don't know where it would go, but it would be perfect somewhere. Then what's the process? How many layers of approvals do you have to get through?
So that's something that we are currently working on. So I've written up a new collection management policy for us. We are in the process of creating an art advisory council that is going to be similar, but an updated version of what existed in the 70s, and coming up with the right sort of procedures so that it isn't like just up to me to make the decisions or just up to my boss to make those decisions. But we really want to make sure that every decision, like I said, every decision we make is very intentional. And that when I present works, I think I would say it's similar to how museum curatorial staff presents work, so that you have the works that you feel are a good fit for your collection. Perhaps there are certain artists or certain types of works that are missing from the collection, coming up with a really well thought out presentation as to, why it's these specific works, why you need to add those, where they're going to go, what their importance is, and then working on kind of moving that up the ladder. But I would say that our process is pretty similar. to how museums are working with that.
Do you have any idea what percentage of the collection isn't on view? Is there a lot of, I mean, you have to rotate paper and photos, right?
Sure. So actually I do have an idea of that. And that's because one of the first things that we tried to do I'd say in the last couple of years when we were looking at how are we going to move this collection in a really intentional way throughout all the spaces was that was about, I'd say 2,500 pieces that were in storage. So we professionally photographed all of those. We're working on making sure that everything in our database is up to date, that we have a complete inventory. So there were about 2,500 pieces in storage. We're working to get those out. I think we might be down to maybe 1,500 or 1,800 in storage. In the last few months, I've put up over 300, 400 pieces throughout all the spaces. Yes, we do have work in storage, but our ultimate goal is to make sure that all of the work is up throughout all the spaces and is there for other people to enjoy. So as soon as work comes in for a donation or an acquisition, once we process it and find a suitable space for it, we do try to get it out as quickly as possible.
In the museum, well, in the print department, of course, everything was not framed because storage, etc., money, everything. Do you have a framer on? Who's your framer?
We do have a framer that we use. A lot of the work that was in storage was all in flat files. So we're working on getting that framed. We're also working on going through all the facilities and making sure that the framing that we have up is all uniform, that if there were frames that were up from years ago that might not have proper glazing on them or are, right in front of a window, that we can take those down and reframe those as well. Make sure that everything is there for people to enjoy, don't have frames covered in paint or, scratched up, those sorts of things.
But it's money. I mean, framing is...
Well, that's exactly the issue that I think everyone has is funding. And like I said, we're grant funded. We're doing our best to try to get up everything that we can and make sure that everything is beautiful and is there to, was presented in a way to serve therapeutic purpose. But that being said, it does take a little bit of time while we find money for everything.
Right, exactly. How tight are the hospital art people? Do you have a network, a professional crew, or is it?
So that's something that we're also working on. So each one of the hospitals kind of operates as its own sort of entity in a way. So like the hospitals, like Bellevue has their own CEO, King's has his own CEO. And some of those facilities do have an arts council on site. So South Brooklyn Health, which was formerly Coney Island Hospital, they have an art team. There are a few of the Gotham Health sites that also kind of have an art team. And that's something that we're working on is really solidifying what these teams are going to be like, coming up with a certain number of meetings throughout the year that I can have with them to really understand what they're looking for, what they want as kind of the cohesive message in their space. And when we're putting up works that are maybe not in one specific department, but are in major thoroughfares, having them look at it and making sure that it, kind of fits into what their mission is for their space. It's a yes and no, and we are working on it.
Right. Hey, you've only been there for 11 months. I think that's fair.
I think it's also because we have, 90 plus sites throughout 5 boroughs, and everyone is so different. I think with all of the questions, like they're all great questions. Unfortunately, because everything is so different and because we're such a huge system, it's a different answer depending on, which space we're talking about.
Right, of course. But I was thinking about the networking beyond New York Health and Hospitals, like, the Cleveland Clinic, and because I think you're all doing it and you probably have a lot of shared experience everyone could benefit from.
Yeah, so actually in Cleveland for this conference, I actually had a number of conversations with the curatorial team that's at Cleveland Clinic, with the team that's at Metro Health, which is the public hospital in Cleveland, and really kind of talking about how we can collaborate, how we can have learn from each other certain things that perhaps Cleveland Clinic has already figured out and has in place because their department has been around for quite a while, are things that perhaps we can learn from because our department is very, very new. And then other elements, like our department really, really focuses on evidence-based design and the scientific research behind specific pieces and kind of what we're doing, that's something that, that we're going to hopefully have some more conversations with the Cleveland Clinic about, because they kind of express that that's something that they would like to focus more on.
So in addition to everything else, you have to be a social scientist researcher person?
I mean, I think it's great. I think it's, my feeling has always been, like, in the art world and with this, is that the larger your network is, and the more you are transparent and you communicate with other people, the more you can learn from each other. So, I kind of think about it that way, that, everybody has a different way of working. Everybody has a different way of thinking about what they're doing. And kind of the more we talk and the more we share, the more we can all do our jobs better.
Sure. I mean, it's an all boats rise kind of thing. We're all trying to make the world a better place.
Exactly.
Right? Through the arts. That's our mission.
Exactly.
Oh my gosh. I can't believe that you were thinking about medical school and here you are in a hospital system, but in the art. It's so funny. I love it.
So I also want to tell you about our exhibitions, because I am very excited about them. And they do include some prints in them as well. So I'll send you more information afterwards, and I hope that you'll come to some of our openings. So we have our first show that's opening next week is actually a collaboration with another city agency. It's the Department of Health and Mental Hygiene. We're doing an exhibition around healthy eating, which is something that we're using to highlight a number of the different initiatives that the mayor's office is doing, that Department of Health and Hygiene has, and that New York City Health and Hospital has also. So we have an exhibition that has a number of different works of people in cafes, different types of food that we have in our collection, really trying to show people, what does healthy eating mean, about eating in moderation, looking at plant-based diets, looking at that whole thing together. And the exhibition we have opening up in October is a collaboration with the Creative Arts Therapy team at Rikers, which is taking a lot of the work that the incarcerated persons who are there have done through this program and having it in conversation with works from our collection.
Oh, cool.
So we're going to be doing a little event next month. We'll have a group of musicians who are formerly incarcerated person performing. And so that's something that we're really excited about. And then later this year, we're going to be doing an exhibition with City Hall.
Oh, okay. Wow. That's cool. Where's the exhibition space?
So the exhibition for Department of Health and Hygiene is going to be in their offices. Our exhibition with the Rikers is going to be at Woodhall, and then the City Hall exhibition will be at City Hall. As we build up our exhibition program, that is something that we are looking for, thinking about. Our different facilities going to have a permanent exhibition area where we'll do rotating exhibitions. Are we going to collaborate with other arts organizations to kind of share works from our collection, or, kind of what does that look like as we move forward?
Individual works or series of works in various places with QR codes and information is a whole different thing than come in and think about this larger theme. It's a different kind of looking, I think, too.
Exactly. So like our exhibition with Rikers called Creating Within, the people who are on Rikers Island have also created a number of different songs and poems. So those we are going to be including as well. So that's something where Bloomberg Connects is actually great, because people can go through this exhibition, they can look at some of the pieces on the wall, and then they can scan the QR code and then hear people singing or performing these additional pieces that go back to the works that are on the wall.
Nice. Oh, that's nice. It's oh God, it's, this is all making me think about how the first thing to go in schools is the arts program, right? And how we, people who understand how powerful the arts can be, are doing it anyway. Like we're, sure, you're not going to teach our kids how to do it, but the system is going to continue. And at some point, somebody will finally help us all be recognized as the important part of society that we are.
Exactly.
But I was thinking about the first exhibition about healthy eating, and I'd have to do some digging to find something that would be helpful for you. But back in the late 90s, early 2000s at the Baltimore Museum of Art, where I had just started, they were getting some buzz because one of the docents had designed a tour that was focused on eating disorders and healthy eating. And so it was, specific works in the collection. They would go around and talk about various issues. And it was it was highly regarded. And I'd have to see if I can find something about that and get it to you. Because I think it can be super powerful in addition to the sort of seeing yourself represented kind of an idea,
Yeah. Yeah, that would be great. That would be great to see. I think one of the things that we've been looking at with our exhibitions, again, is a variety of things of how can we create this beautiful and like visually engaging atmosphere, but also when we have exhibitions that are inside one of our facilities or in another city agency, what can we do to educate people about all of the different tools that we have and the different services that we have? Because I think that no matter how good of a job, we all try to do of promoting what we do, there's so much work that happens that I think it isn't possible for everyone in New York City to know every single thing that we're doing. And so we kind of feel that through art, if we can share more about some of these really helpful, really beneficial things that other people in our system are doing, then that's great.
I feel like there's a real hangover idea about hospitals that are, I think, in most people's eyes for healing illness, and the wellness aspect of the healthcare systems. It's like people haven't quite caught up that's a large part of your mission and activities also.
So we also have at Health and Hospital, we have a department called H3. It's called Helping Healers Heal, which is a wellness department, which is focused on making sure that our actual caregivers and our staff are feeling, that they're focusing on their own wellness. So I'm working with that team to do 20 different wellness rooms throughout our different sites that are specifically for the staff. There are a number of different programs where people can reach out and have a peer counselor. And there are a variety of different programs as well that are put in throughout the week to give people a break and have them stop and slow down. Because we found that if the staff and if the caregivers, if they're stressed, then it's much harder for them to really, really focus on the people that they're working with. So I know that is something that's been a pretty major focus at Health and Hospital. That's part of our quality and safety department.
Right. Oh, that makes sense. I'm sure post-COVID, it's just been, or during COVID, even like this whole idea of taking care of staff is super important. Mm-hmm. What you guys need is every hospital for staff, you need like a James Turrell room where the light shifts really slowly.
Exactly. Well, if you know anyone who's interested in putting in a James Turrell and helping fund the entire thing and help us install it, send them over to me. We can definitely have a conversation about that.
All right. I'll see what I can do.
Some of that, though, has been thought about moving forward. So, for example, in South Brooklyn Health, it's like a brand new hospital that was built. It was kind of destroyed during Sandy, and it was just opened at the end of last year, is that on a number of the different floors, part of what's been thought about is that kind of color scheme of thinking about more soothing lighting. I believe that their vision for that was to do sky, sand, water, something along those lines, so that when you look up, the lighting fixtures kind of make you feel like these are beautiful clouds in the sky. They have what they call vistas. So at the end of certain hallways, they'll have kind of an ombre of colors to have it look like, the sun is setting or the sun is rising, so that as you are rushing through these hallways, you have that moment to kind of stop and a moment and recenter yourself. So there has been a lot of that thought put into our designs moving forward. So with the wellness rooms that I'm doing, I work directly with the wellness team. I work directly with the interior design and the architectural company that's been used for each one of these. So we make sure that each part of it, down to the furniture, the wallpaper, the artwork, that everything works together and it really works with that specific space and with the specific people who are going to be using it.
Has this experience for you changed anything in your house?
I don't know if I'd say it changes what's in my house, but I do live with a lot of artwork, and it's made me really, really appreciate that is the type of space that I can live in. And I think given me a better understanding of the reasons as to why as soon as I enter my home, why I instantly feel relaxed, and why I think that a lot of people, when they first move into a space, when your walls are just, just white or just gray or whatever the colors are, until you've unpacked and put something on the wall, you kind of feel a little bit of stress. You feel like it's not necessarily your home. So that's given me a real appreciation of not just like knowing it, but understanding why I feel that way.
Yeah, it's something I think we all feel in our gut, but kind of bringing it to the conscious forward. Yeah. It's like advocating for just being hyper aware of your surroundings and how you maneuver through it's just I think it's just a mindfulness, I guess, is really where I was going.
Mm-hmm.
Yeah.
Some of the things that I've been thinking about more is as I look at the work that I personally collect or that I have collected for, for previous roles, what is the reason why that work appeals to me? And what are the different things that come to mind? What are the emotions that I feel? And I've always been someone who feels that if you have artwork up, if you have a reaction to it, good or bad, that's worthwhile and that's important. Even if your reaction is that you see it and you hate it, and you want to tell everybody how horrible it is. I've always felt that's good. That means that art is working, that it's doing something. And in this role is looking at work and thinking about, yes, that is still important, but we have a very specific role. And while we want people to be thinking about what this work is, about having different emotions and really working through things for themselves, we want to have it be an overall atmosphere of calming, of healing, of relaxation. And so, always having that in mind, that just because somebody is a well-known artist or because they are well respected in the art world or what they're showing in their work, just because that's powerful and that's important, doesn't mean that that's suitable for every space and every audience.
No, for sure. Yeah. As I've shifted out of the museum world into independent curatorial work, the bar at the museum for works that had conceptual rigor and had meaning and meat and, you could chew on it. And, that's just not what's happening in the rest of the world. It's just a whole different point of view. It's fascinating.
I think some of it is actually been really great because there are pieces like that we do have in our collection. And some of those are great to kind of spark conversation in some of our different departments in central office. So I put up a series of work in our population health department and our legal affairs department. And, as we kind of do that type of work, it is a very different space because it's not clinical. We can put up a different type of art. And so, so those are conversations that I think are really important to have is, what type of conversations do you want your staff to be having? Do you want people to have when they come into your area? And if it's a non-clinical space, there's a lot more of those and a kind of a wider variety.
Yeah. When I was a museum person, the kind of calming, soothing art that you're describing would be in that arena decorative. And so it's like the power of art on both ends of those spectrums is a different kind of power, but just as powerful.
Exactly. And, it's really not always that simple of like, it's just this specific type of imagery or this specific type of color. So for example, if there's artwork going up in a space where the department might be in the middle of a hospital and they don't have any windows, it's important to keep that in mind and to try to perhaps add more work that has images or kind of the feeling of oceans or nature or kind of looking out into the world so that what gives the people in that area that sense that they aren't quite as closed in, that they really do have this beautiful space and they're kind of looking out.
Right. No, it makes total sense. It's just amazing, people. Art, it can be applied anywhere and it can help in many ways.
Exactly. Yeah. And I would say the majority of people in New York City probably aren't aware that we have this collection. There are people who perhaps have gone into one of our facilities and not noticed it, or they go to one of the private hospitals and they see artwork up and think that, it's art is only there for people who, have a certain type of insurance or have a certain type of background and they're going to a private hospital. But I think that, having art in these spaces is also really important because part of our mission is to be there for everyone, no matter what their background. I think part of that is also treating everybody, as much as we can, treating everybody the same. And that means that if in the private hospitals, their walls are filled with beautiful artwork, then in the public hospitals, they should be as well.
Yeah, no, I think I agree with you. No, that's good. It's so, oh, golly, what a big job you have.
I feel like this is kind of ends up being the conversation with pretty much everyone when we start to kind of share what we do, which is, oh my gosh, I had no idea that this existed. I had no idea that you did all of these things. And then it follows up with, oh, have you thought about adding music, or have you thought about adding, dance therapy or something? And then when we follow up and say, yes, we actually have all of those sorts of things and we're looking to expand, it's honestly, it's really pretty cool to see how excited people get. And I think that's why, we're so excited about it and why we want to share what we're doing and continue to grow, because it is such a wonderful program and it does have such value for both the patients and the staff that, it's really fun and really exciting to share with other people.
Right. So in the desire to have more people know about what you're doing, so do you have an online database that's available?
We have a database. It is internal. We are working currently to get up every piece that we have in our collection onto Bloomberg Connect so that way everybody will be able to see it. Our mission is to make the collection accessible to everyone. We're thinking about this app as it's a tool for people while they're in the space, but also if you went, say you went to one of our dental clinics and you saw something up on the wall and you thought, oh, this is so beautiful, I actually want to show my mother, or I want to show my friend, you'd be able to then show them on the app. And they could do the same. They could say, oh, I went to this other facility and I was there in adult medicine and these are the pieces I saw, and be able to share those pieces.
Well, so I'll include any website URLs you want that might point people at more information about your program, and if that links to articles, or happy to do that.
Yeah, that would be great. Yeah, we'd love it if people took a look at our website. There's a bit more about the programs, all the programs that we do, a bit more about the collection, about the history of the collection, and then, like I said, on Bloomberg Connects, we are working to add every piece that we have in the collection. And hopefully we will be adding as well some archival material. We have quite a lot of records of different letters that were written by artists when they were commissioned to do work. So Romare Bearden, Keith Haring, like I mentioned, Helen Frankenthaler. And so we're looking to try to make that available as well. So if there's people who are doing research or, writing different educational papers, that, we can really make that accessible to them as well.
Oh yeah, that would be great. I have lots of researcher friends who will be like, Romare Bearden, I need to see those.
Yes, please send them over to us. We're happy to answer any questions. We have we have a number of Romare Beardens, but we have a really beautiful, very, very large collage piece at Bellevue.
Wow. So this makes me think, one last question. Do you guys lend?
Yes, we are open to lending work depending on, what the situation is, where it's going to be. It is a city-owned collection. We do want the work to be accessible to everyone in New York City, and we do want to provide as much educational material as possible. So we're definitely open to conversations about lending the work to different museum exhibitions as well.
Yeah. Oh, that's great. Okay. So you've heard it here first. Oh, and then, of course, one last question. How much of the collection is prints, and are you a print nerd like me?
Sure. Yeah, I would say there's probably around 3,000 prints in our collection, and that ranges from silk screen to woodblock to lithographs, monotypes. We have prints that then have collage materials on top of them or have been hand painted as well. So we do have a pretty large collection of prints.
All right.
Yeah, I think the prints have been really great for us as well, because there are certain images that we have that we are lucky enough to have more than one from that edition. So if there's certain pieces that perhaps the edition was a size, was 50, and in the 70s we were given maybe 20 of them, it allows us to really spread those pieces out throughout all of the spaces.
Right. The beauty of multiplicity.
Exactly.
All right. Is there anything else we haven't said that you wanted to share with people before we go?
No, if people want to reach out to me, I'm happy to answer other questions. I'd say, I mean, I could probably talk for hours and hours and hours actually about like, what we're doing, our different programs, our exhibition, our WPA murals. We have so much going on and we're looking to expand so much. So yeah, I'm happy for people to reach out to me and to answer other questions.
Okay, great. Well, Naomi, thank you for coming on Platemark. There's so many little corners of the art world and everyone's working so hard to do great things,
Yeah, thank you so much for having me. I hope this gives people an opportunity to learn a little bit more about arts and healthcare. And I think that if people start asking other friends of theirs in the art world, other dealers, other artists, other curators, they will learn that there actually already are a lot of collaborations between different galleries and healthcare systems. And there's a lot more of a crossover than people think.
Right. We just need to be able to find you guys.
Exactly.
You're never on the staff on the staff page of the hospital system. Like, where
Well,
are you?
we are. We have everything listed on,
Okay.
on the hospital site about our department, who and who our staff is as well.
All right. Well, thank you again. It was really great talking to you.
Same. Thank you.
Thanks so much for listening to this episode of Platemark with Naomi Huth. I hope you enjoyed it as much as I did, as I'm just fascinated by this intersection of science, health, wellness, and art. It's obviously a busy sector of the art world that somehow is not that apparent to me. So I was glad to uncover some stuff. It's just me doing this stuff, and I really could use your help in supporting us. If you value the content that I'm creating, please head over to the website, platemarkpodcast.com, and hit the support and donate button. Your support would mean everything to me, and I thank you in advance. As always, I need to thank Michael Diamond for the use of his original music, and thank you to Dan Fury of Extension Audio for helping me with sound and a first pass at editing. I appreciate the help, and I'm a terrible sound person, so he is a critical cog in the wheel. Oh, you should come over to Facebook and join our group, our Facebook Platemark group, because we're all sitting in there chit-chatting away and talking about all sorts of stuff, and I think you would enjoy it. So come on over and join us. That's it. We'll see you next time.